sight, a precious gift we cannot take for granted. Our eyes are windows to the wonders of the world, all that we know and love, experience and discover, ponder and cherish. In today's world, our eyes are constantly facing different challenges that deteriorate vision and lead to blindness. Maximum intraocular penetration of a drug is critical. Different clinical studies demonstrated that the drug should penetrate the target tissues at therapeutic levels, reducing anterior segment inflammation and, more importantly, reducing CME in the posterior segment of the eye.
To overcome these challenges, like inflammation, CME, in normal and high-risk patients, Remington Pharma is proudly introduces
Nepanac. Contains Nepanac 0.1%. For deep and strong penetration. Unique target-specific molecular structure of Nepanac. As published in different clinical studies, Nepanac 0.1% ophthalmic suspension is the first and only topical NSAID structured as a prodrug. Upon ocular dosing, Nepanac penetrates the target sites: cornea, ciliary body, choroid, and retina, interocular hydrolysis enzymes, converting Nepanac into a potent cyclooxygenase inhibitor, Amphenec, an active metabolite that has strong anti-inflammatory capabilities. This prodrug novel target-specific structure of Nepanac provides enhanced interocular penetration, optimal distribution at various target sites, minimal side effect profile, rapid onset of action, longer duration of action, and more pronounced analgesic effect in both anterior and posterior segments of the eye. Nepanac provides excellent ocular permeability. According to Cataract and Refractive Surgery Today and current medical research and opinion, Nepanac corneal permeability characteristics are superior to those of ketorolac tromethamine, diclofenac sodium, and bromfenac sodium. Results demonstrated that Nepanac has been shown to achieve a penetration rate 6 to 8 times greater than conventional NSAIDs. Nepanac rapid penetration exhibits superior prostaglandins inhibition in CME. According to Cataract and Refractive Surgery Today and Inflammation, Nepanac significantly inhibited PGE2 synthesis, concomitant with significant suppression of blood-retinal barrier breakdown. Above clinical data demonstrated that Nepanac is superior in reducing inflammation in the posterior segment as compared to diclofenac 0.1% and ketorolac 0.5%. Nepanac has superior and persistent anti-inflammatory efficacy in both anterior and posterior segments versus diclofenac sodium. According to Cataract and Refractive Surgery Today, Nepanac is superior in blocking the production of prostaglandins in a uniform manner versus conventional NSAIDs, such as diclofenac 0.1%. Results showed that Nepanac inhibits 95% of total prostaglandins formation by iris ciliary body within 80 minutes after topical dosing, compared with diclofenac's 53%. Nepanac also maintains significant anti-inflammatory efficacy from 15 minutes to 8 hours, unlike diclofenac's 4 hours post-dosing. A single drop of Nepanac with multiple benefits for CME. As published in Ophthalmology Management, Nepanac, with or without concomitant steroids, reduced retinal thickness and improved visual acuity with acute and chronic CME in high-risk patients. According to expert review of ophthalmology, the combination of Nepanac and topical steroids appears to be effective in preventing visually significant pseudophakic cystoid macular edema after cataract surgery. Nepanac ensures patients' compliance due to established safety. As safe as the placebo. According to clinical ophthalmology, the incidence of ocular adverse events, such as decreased visual acuity rates and capsular opacity, were indeed similar in patients receiving Nepanac and those receiving vehicle. No burning and stinging. As published in Eye World, the news magazine of the American Society of Cataract and Refractive Surgery, Nepanac suspension was found to be comfortable and well tolerated, with virtually no reports of burning and stinging. No ocular and systemic toxicity, even when dosed higher. As published in Eye World, the news magazine of the American Society of Cataract and Refractive Surgery, Safety of Nepanac has been confirmed in multiple studies, as prodrug appears to have an extremely low potential for ocular surface toxicity. Even when dosed for 6 months at concentrations 15 times its commercial formulation, Nepanac did not show signs of ocular or systemic toxicity. A novel NSAID for deep and strong penetration. Nepanac offers strong anti-inflammatory effect due to deep ocular penetration as compared to conventional NSAIDs. Nepanac offers proven clinical efficacy and success rate in high-risk patients for CME. Nepanac offers quick relief from postoperative pain and discomfort. Nepanac offers time-tested safety and tolerability. Thank you for your attention.